Um, so hello everyone. It's really nice to meet everyone and everyone who joined us on the first for this year International Career Toolkit Series. This year and this toolkit series, we start with amazing topic which we're gonna discuss with amazing speakers on the career journeys in global and public health. So first of all, I would like to introduce our outstanding, amazing speakers who will talk today and share with the insights with the students and ask to all your questions. So the first speaker is Dr. Hillary Bracken. It's really nice to meet you today. She's Program Officer for the Healthcare Delivery and Disparities Research Program at the Patient-Centered Outcomes Research Institute. And also our second speaker is Mary Kameni. She is Global Health Studies Certificate and Associate Director of Research and Evaluation at Maternity Care Coalition. And also I would like to introduce our moderator for today's event. It's Elaine. She's Associate Director at the Global Studies Center. So if you have any questions, you can ask in the chat, or you can unmute yourself and ask and give your question to our speakers. Thank you.
Thank you so much. I'm going to just jump in here. Thank you so much for organizing this. And I'm so pleased that we have right now 20 students that have identified this as a priority with all the other things that they're doing, studying, working, attending other events on campus. So we value, Hillary and Maddie, your time and that and the students for attending. The University Center for International Studies has this ongoing career toolkit series that we touch on a variety of different professions, so students can imagine what is out there and how they can build on what they're studying here. Also thinking about what classes would, if they have some time left that in their studies, what type of classes would prepare them for, your careers type, things in your careers, what kind of transferable skills they could be building, and what type of experiences to have in terms of internships, work, research that will prepare them. So really what it is, it's what I know Shastkova told you about this, but what I think we'd like for you to touch upon is what is your what do you do at what your place of work is about, what kind of services do you provide, what type of what does your day look like, also your career path. I have your more in-depth CVs here, but for you to share that with them. And then after you guys present, I'd really appreciate it. This is for the students, if at all possible, like Jasmine has put on her video on, so it really is a dialogue amongst us all rather than kind of one-way listening. So it's a two-way conversation. So I think once we open it up, if you guys could take this time and we so value you being here. So Hillary, why don't I'm just going to go a little bit more in depth just for you guys, because this is hosted by the University Center for International Studies. Hillary got a BA in Asian Studies from Dartmouth College. She holds an MHS from Johns Hopkins University of Public Health, an MA from the University of California, Berkeley in the Department of South Asian Studies, and a doctoral degree in history from the University of Virginia. And here she is now working for the Patient-Centered Outcomes Research Institute. How does that all work? Thank you, Hillary.
Sure. So I guess I'll start out with where I am now. As you said, I work at the Patient-Centered Outcomes Research Institute, which is called PCORI for short. And it is based in Washington, D.C. We are a nonprofit entity that was actually started under the ACA or Obamacare, the legislation that created Obamacare, more or less, also created PCORI. And we fund patient-centered outcomes research. So that is, by definition, it's research that matters to patients. So we do both health systems and clinical research. And I work in the healthcare delivery and disparities research unit. And so most of the studies that we're looking at are looking at testing. It's called comparative effectiveness research. So we're testing two things that are already out there, two effective interventions to, in most cases, address disparities in care, whether they be among certain populations based on race or ethnicity, or income or region for rural populations, for example, or for patients with special needs, intellectual or developmental disabilities. So all, or gender minorities, like a whole wide variety, but that's sort of at the core of our research. And as part of my day-to-day job, I am responsible for both managing. So as a funding organization, researchers will write applications or proposals for funding in response to announcements that we write. And so as part of my job, I both write the announcements, and then I also manage the awards that we eventually fund. And let's see, what else should you know about it? So my day-to-day is a lot of interaction with principal investigators or doctors or public health experts that are conducting research as funded by PCORI, and sort of checking in on their projects and finding out, what's working, what's not, and also sort of we discuss the science, but we also discuss sort of the administrative side of doing research, because that's something that actually, once you're in the job of research, that's a big part of it, is making sure, program management skills, for example, are really important for that piece of it. So that's kind of what I do day to day. In terms of how I got here, as you can probably hear from my academic history, it was not a straight shot to my current position. I actually joined PCORI 2 years ago. And prior to that, I had worked in global health. And I will say even that my sort of position in global health also was not a natural consequence of sort of, I guess, it's funny. I heard a job talk today where someone was talking about how it's not a career ladder, it's a career lattice. It's sort of like, you're moving up, you're doing all sorts of things that kind of connect you in different ways to different paths. And I think for me, at least, I started out as an undergraduate, very interested in, I'll just as a sort of global health, but more global development issues. And I think as an undergrad, I think one thing that I guess my recommendation based on my experience was that I had the opportunity to do a research project as an undergrad, in part because we had funding available. And I really encourage all of you to seek out these resources at your, at your academic institution, or even sometimes outside you can get funding. But especially if you have curiosity about something, there's all these opportunities either with faculty directly or, sort of independent research opportunities. And if you have a question that you want to answer, that's a great way to get started on research, is by having those partnerships with faculty, or, your own independent research. And I think the other thing that I also ended up doing a senior thesis that was in South Asian history, actually. And again, I got to work very closely with a historian at Dartmouth. And it was one of the things that sort of got me really interested in doing additional research. And he was an amazing mentor. And so again, I like using those resources that you have at your academic institutions are so important. I think the other thing that I also worked as a nurse's assistant, actually, in a summer during an assisted living facility when I was in an undergrad. And I think it gives like taking jobs that like put you in settings where you get to think critically, especially in the public health sense, about like all the things that influence people's health. That would be the other sort of takeaway, I would say, from my undergraduate experience. After I graduated from college, I was a Peace Corps volunteer in West Africa. And that again, did health education. And that's another great opportunity, I would say, if you're interested in global health, to get some idea of like on the ground, sort of what it looks like to be doing public health in a variety of different settings and different kinds of activities, because public health is so broad. And I feel like, especially now, there are so many opportunities at like the intersection of, say, environmental studies and public health, to think about how, where we live, work, and play, or other people live, work, and play, impacts their health. And so and I think with things like Peace Corps or other volunteer opportunities, it kind of gives you a chance to see on the ground how that plays out in real life, and start to think about how you could make a difference in some of those issues. So after I was in Peace Corps, I came back, and I had always wanted to, again, I've been a South Asian Studies major. The thing about Peace Corps I loved was the opportunity. At the time, I was speaking French as part of my volunteer experience. And I really wanted to go back to South Asia and study a South Asian language. So I ended up, going to study Hindi, and then received some foreign language and area studies fellowships, which probably are available at Pitt. So here's another thing to look out for, because those are a huge opportunity in terms of supporting both language learning, but also academic, specific research activities related to that. So I had a FLAS at Berkeley, and then I went on to study at the American Institute of Indian Studies, which is, again, a federally sponsored language program in India that has, it still exists, actually. I don't know their language probably still do, but so I was there for a year studying Hindi, and then came back to start a degree in a PhD in history. And I found out when I was doing my Dr. Del Noor will appreciate this. I was doing my dissertation sort of defense and other things, and I realized that life in the archive was not for me. So it was one of those things where I sort of changed course and ended up getting a master's in public health. And then went on to work first at the Population Council in New York. It's a big, was started by the Rockefeller Foundation, actually, but does research in demographic and public health. And then I worked there for about 3 years. And then I went on to work for almost 15 years at Genuity Health Projects. And we did research, clinical and operations research in reproductive and maternal health. And so that was where I did most of my academic, I would say my public health experience is there. I guess my takeaway from sort of all of that is that, again, you never know where things will lead you, but I think good research skills, they transfer, so even if you're in the humanities or social sciences and you decide that, okay, maybe I want to do something more technical, whether it be engineering or public health, statistics and whatnot, that those core research skills can transfer. What else would my only other suggestion with that would be, I guess in terms of seeking out mentors, because I had a mentor when I was working first at the Population Council, who he ultimately was the one who got me to finish my doctoral dissertation. But I think because he saw the application of sort of the policy questions that my research was looking at in terms of what was happening today in public health. And so just that, again, that there's an intersection between, say, the study of history and the study of public health today. And so that would be, I guess, another recommendation. I will stop there because I realized I'm starting to ramble, but I do welcome your questions, or I'm happy to talk about any of that. But all to say that it's never a straight course, I would say, from where you start to where you end up.
So we have a question, but I'm going to hold off on the question for a minute because it's kind of a general one. And then I'm going to now introduce Maddie. Maddie was a University of Pittsburgh undergraduate. She graduated in 2016 with a BA in economics, sociology, and a certificate in global studies. She also studied abroad in India and studied Hindi. Maddie went on to graduate with an MPH in health behavior from the University of North Carolina, Chapel Hill. She worked as a special projects coordinator at Delaware Valley Community Health, and now is the Associate Director of Research and Evaluation at Maternity Care Coalition in Philadelphia. So Maddie, welcome and nice to see you.
Thank you, you too. And the Hindi thing is so funny, Hillary. I definitely did not get as far as you did. I just did it in undergrad and wished that I remembered more of it, but that's such a funny coincidence. But yes, thank you for having me. So yes, I went to Pitt. I saw this question in the chat that I'm sure we'll talk more about later, but I have to address it because it's part of like my story of getting into public health. Is, do you have to be pre-med? Do you have to do bio? I knew I wanted to do public health when I was an undergrad, but I didn't really understand the breadth of it. And so a lot of people would say, oh, so you're pre-med or like you're nursing. And I would be like, no. And people would be surprised, but I wouldn't really be able to articulate why I didn't need to be pre-med. Like I didn't know why I didn't need to be, but I knew I didn't need to be. But so I feel like the global studies certificate and department was a really great way for me to just be that was kind of the little area for global health, because there was no public health major. I think there still isn't, right, at Pitt. Oh, there is now. That's awesome.
There is now, yeah.
That's great, yeah. So but it was kind of also like an introduction to intersectionality for me and interdepartmentalism, just because of the nature of the courses that you all offer and the departments that you partner with. So that was my journey in undergrad, was really like, how can I like kind of piecemeal these majors and certificates to make sure I'm getting like some qualitative, some quantitative. I think I want to get my MPH, but I don't know what does a pre-MPH look like. So I kind of just tried to build it, and Elaine was super helpful with that. So I ended up doing AmeriCorps after my undergrad. I stayed in Pittsburgh and worked at a federally qualified health center. It was like real grunt work, but I loved it because at the time it's like that was my first introduction to any of this stuff. So it was like population health, like I'm literally just calling patients every day being like, hi, you need your blood pressure done, you need your A1C done. But I was like, this is so cool because it affects data. And like it was like, if you're into that kind of thing, you don't get paid very well, so you have to kind of have like a plan for how to figure that out. But it was, for me, it was really cool. I went back to North Carolina to get my MPH. I'm from there, and I got in-state tuition, so that helped a lot. So at the time, I don't know if you all are aware that in the past few years, the MPH programs are doing like this Common Core type of situation where it's more standardized. So all the students, you can still have concentrations, but you take kind of the same like base classes. It wasn't like that. I think I was like the last year of MPH that didn't do that. So I was in the health behavior department, which is kind of a misnomer. Like it's some people did do like individual health behavior, like health kind of like decision making, psychology, but most people were macro. And I think that's one of the reasons that they've changed the way that that's marketed, is because people didn't really know how to market themselves. So most of it was macro. I stayed in North Carolina for a bit and worked in population health at UNC Healthcare. So just massive healthcare system. I did not enjoy being a tiny fish in a huge pond. And it was also patient facing, which was good because I learned about healthcare. But it was like, again, I didn't have that clinical background intentionally. Like I didn't go to nursing school. I didn't go to med school. The last bio anything class I took was, I think, like sophomore year of college at Pitt. So I didn't, I knew that I didn't want to go down that route. And I was like, I don't know like what the next step would be for me in this type of role. So early COVID, my wife and I moved to Philly. So I started working at another federally qualified health center called Delaware Valley Community Health, which has multiple sites throughout Philly. And I was doing, again, like not a patient-facing role, but it was a clinic, you know. So I was doing basically project management, and I was overseeing the AmeriCorps program, the same program that I did, which is like a subset of AmeriCorps called National Health Corps. And so it was good for that, and for like learning how to juggle multiple projects. And when you have 9 sites, like there's going to be a lot of communication strategies to learn. But again, it was a clinical setting. So when I was working on a blood pressure, project for patients, like I always had to defer to the nurse on the project. I can't be making those types of decisions. So I was like, where am I going to go with this next? Like, I still didn't feel like I had a job I had a job yet that I was using my MPH for, which is why I'm really happy that I discovered Maternity Care Coalition only 6 months ago. So I'm brand new there. And I really feel like this is very MPHE. And instead of kind of trying to fit the things that I enjoy about public health into my job when I didn't really have time to do it before and there wasn't capacity in a clinical setting, now it's like there's a whole department built out for what I'm doing. So I'm in the research and evaluation department. You said typical day, right, Elaine? Or just an overview? Okay. What I really like about this job, this is, again, like best fit job I've had. And something that initially drew me to public health is like this balance between big picture and detail thinking. A lot of like, I think if you all are interested in public health, like we can't make decisions. We like everything. That's kind of the, like we're all here because we like interdisciplinary things. And often we are kind of, we're just good at a lot of different things and can't always find a concentration. That's what I've noticed with like other people in public health. So I love that in this job, I'm able to like use that. So part of what I do is very big picture. So for example, we have at Maternity Care Coalition, which is a home visiting program. There's about 20 programs under MCC in the Philadelphia area, and they're home visiting. Most of them are home visiting for pregnant people, families, children 0 to 3. So as you can imagine, again, with 20 programs, everyone's kind of analyzing different things. You have funder requirements that people are required to follow, whether it's federal or other funders. And then you also have, there's things that departments are interested in knowing, right? So I work with these programs to varying extents to figure out what data they need, and kind of work with programs have varying levels of like data literacy. So not everyone has the capacity to understand data integrity and how the data that you put in is going to be the data that comes out of the system. And not everybody does or needs to understand the back end of the database. And that's not my expertise either, but I do need to be able to translate between the people who work in the database and the people who implement the programs. So I have big picture things like analyzing enrollment and retention patterns. So we want to see, for example, are there certain subsets or demographics of patients who are staying in our programs longer and benefiting more? And even more importantly, are there people who are not? Are there patterns that we're not serving a certain population very well? And for that, of course, we need lots of data. So a big part of my job is making sure that the data gets in so that in a year we can analyze it. I also, so when I think about like detail-oriented work, which I also really enjoy, I do a lot of survey, I would call it like standardization. So like I said, programs use different survey tools and methods. To the extent that we possibly can, we're trying to standardize those because, as you can imagine, on the back end, you're getting, one program is going to ask, how many weeks did you breastfeed for? And another program is going to ask, were you still breastfeeding at 6 months? How do you reconcile that data? So we're trying to standardize that and getting really into the weeds of like literally the order of the answer choices of the questions to see if does that affect the way that people respond. Spoiler alert, it does. The way that we word the questions, for example, demographics, is there a way that we're wording race and ethnicity to adhere to funder requirements that's not actually resonating with people, and we're getting a bunch of missing data because they're like, I don't see myself in this answer choice. So reviewing the literature and best practices to see how we should be asking questions. So yeah, I do like some of the big picture, some of the detail stuff. I would say like on average, half the day I'm in meetings and half the day I'm like able to do like heads down work. And then also managing people, which takes up a lot of time. So yeah, that's kind of where I am now. And if I missed anything, I'm happy to answer questions.
So I have questions for our two guests, but we'd like to open it up to our students to ask questions. If you feel comfortable, to put your video on, because it's a good time to network with our speakers. But if you don't, that's okay. You can ask the questions in the chat, or you can ask them directly. It's up to you.
Would you like, I can also answer the question with regard to, I think Maddie touched on it a bit about pursuing a public health degree without,
Certainly.
a nursing and a medical degree, because I also have done that. And I would say it's definitely possible. And I would say also at Pecori where I work, we have a lot of folks with MPHs who've come in and are doing a lot of the project management work. And they, of course, didn't have medical or nursing background. Of course, it helps. But to Maddie's point, like thankfully, public health is not just clinical health anymore. And so it's so many different things that I think having good expertise in statistics, to her point, so that you're able to read data, collect data, analyze data is always advantageous. And that, of course, isn't necessarily, in a medical or a nursing degree. I think also, obviously, having project management and other sort of soft skills are always helpful too, which you don't, isn't necessarily part of your academic career, but those you can develop as a student. I would also say that sort of knowledge of policy issues is great because it gives you can understand the language at which the public, especially if you think about programs here in the US, you already know the landscape if you have that political science or policy background. So those kinds of things are helpful. I would say even business experience can be applied to public health, because especially now when we're thinking about both social determinants of health and thinking about how, other sorts of programs that intersect with health can help to address health issues, having knowledge of, sort of housing, transportation, or, sort of even the business of health and the business of medical care in the United States can be helpful, because in order for things to be, we want things obviously to be patient-centered and able to be delivered, but often that cost is a big barrier in many instances to having things accessible to everyone. And so having knowledge of sort of the business behind that is always helpful. I mean, those are just a few of the things. I'll stop there, but and see if Maddie has anything to add. But I would say that you definitely don't need either medical or I mean, obviously it's advantageous, but it's not required nursing or medical background.
Yeah, totally agree. I did not, even within public health, there's so many different fields that you could go from one to another and not really know what they're talking about in terms of like the jargon. Like I had never done maternal and child health before, which is a new like field for me within public health. I came from healthcare, so I knew that jargon, and maternal child health jargon is different. But like Hillary said, the transferable skills were still there. So like data synthesis, being able to write well and concisely is important. And like, even, I mean, this may be more of a something for you to do if you pursue a master's, but I think even now you can start thinking about like how to market your public health skills and think about rather than what you don't know in public health, because it's so massive, think about what you do know that you can transfer to other fields within. You never have to apologize for not having done everything in public health. It's just not even possible. So
because we're hosted by the University Center for International Studies, we encourage language study, even though neither of you are actually using that now. Tell us about thinking back, are you pleased? Do you feel like it was worth your time to study a language?
Sure, definitely, without a doubt. I think the process of learning a language and immersing yourself in a different culture is part of that. I mean, for me, it was my first language. I realized a lot of folks are lucky and they already are bilingual or trilingual or multiple languages. But for me, that experience, I think, was fundamental to sort of thinking through or making me rethink the way systems worked, health systems or other things. And so I think that change of perspective is so valuable in terms of thinking about public health problems or social problems or anything else. And I think also just I would say the rigor with which and the study of language is also helpful in terms of obviously there's a lot of work on sort of brain development, but I think it's all, helpful for understanding and developing systems for learning other subjects. And so, yes, I'm a huge advocate. I think, I would not, even though I don't end up using it in my day-to-day, it still has been such a valuable part of like who I am, as well as my approach to my career in a lot of ways. So.
Same here. I think also because I did a less commonly taught language at Pitt, it was like immediate community because it was just a few of us and we would take we would see each other every semester. So that was really nice. Yeah, and I also think just the global focus in general, we often think of it as like global and local are two very separate things, but they're really not. Like we all know it's not just like the United States and everyone else. It's like a lot of things that we talk about with global health are applicable to what we do here and vice versa. So yeah.
Actually, I do have a question to both speakers. So the question is, the global health field, it's kind of huge field and at the same time it's accurate. And I was wondering what kind of challenges you faced during your internship or fellowship. Maybe any challenges or problems, struggles which you needed to face and to tackle with.
Do you mean an internship like while in undergrad or like is a specific internship?
Yeah, like in general.
Yeah, I think so. I did do an internship. I don't remember if it was linked to like if it was a requirement of global health, but it was related to global health. There's a place called McGee Women Care International. It actually is kind of similar to what I'm doing now. I never realized that. So that was like a local internship with a global focus. And I think at the time my challenge was just like, whoa, this again, like there's so much in this field, like what am I doing? And I was lucky to have the other intern who interned with me was an MPH student. So she had more of that knowledge and kind of helped me like take things apart and be like, okay, this is like what I'm doing right now is a logic model. And if you do an MPH, you'll learn what that is, but this is what it's for. So that was cool. And then I think the biggest challenge coming out of undergrad, I mean, you feel kind of helpless, especially if you're doing direct patient care or client care because you're seeing every single day, like the things you learn about in your textbooks but you're seeing it like on people's faces, which was really difficult for me. Some people I feel like can do that. There were moments during AmeriCorps where it was like I was working with refugee patients and like that was when the refugee ban was instated. So it was just like that was a lot. But on the professional end of that, it was also, like I said, figuring out, okay, if I don't want to work directly with patients my whole life, like what other route do I need to go? Like what is like the fork in the road between the clinical and the non-clinical public health? So I hope that answered your question.
Yeah, I guess I can, when I was at Hopkins, I had 2 internships. I had one, I guess the advantage of was partly location, because I had one internship in the Center for Communication Programs at Johns Hopkins. And I was just doing sort of helping with some additional analyses on a study they had done. They needed some data cleaning. I think that's what I was doing. So like looking through data sets and helping them get ready to do the analysis. And then I also had an internship at the World Bank. And it was, I will say, it was like being thrown into the deep end, sort of, because I had to review all of these reports and I knew nothing about what these reports were about. So I think I guess that's what I remember, is sitting in their office and with giant stacks of reports and having to review them and like sort of write a summary of what the assessment was. I was looking across, what were they? They were, it was like water and sanitation projects across West Africa and sort of making a summary statement. And I think I guess my only sort of learning from that was that it can be, as Maddie said, it can be so overwhelming when you first start, because you don't know any of the language and you don't know any of the issues, and you don't know sort of what is what, and just to have grace with yourself and keep going. And also, this is where the language learning comes in, because I think that's fundamental to if you've ever started learning a language and none of it makes sense, and you can say 3 words and it can be really frustrating. But just keeping at it, and persistence in this case like pays off, because ultimately, like one day you'll wake up and you'll be like, oh, this all makes sense to me now. And just having the patience to sort of get through that phase, because it can be very overwhelming and confusing. That would be my only.
Thank you. How about we do Rachel, then Judith, and then Caroline for asking questions?
Sure, that sounds great. Hi, I'm Rachel. I also did a global health studies certificate at Pitt the same year that Maddie did, which is so ironic. We never met, but I ended up going for a accelerated nursing program and just finished that. But I'm like you said, like combining all of my interests, right? And I'm wondering if there are programs abroad, like there are so many other health systems that do things better than the United States, and how to like compare or get involved or bring the things that people have found abroad to America, or if you know of like any work programs or just like ideas of corporations, businesses, programs that I could just then like look into later on.
I feel like that's a you question, Hillary.
I mean, I guess I will say this from sort of, it's kind of a sideways way to do this, but I feel like when you have an interest like that, I'm just, because I'm familiar with the UVA, the nursing program, in part because of my dissertation research was kind of on the history of nursing and in India. And so I met a lot of the nursing faculty there. And I feel like when you have questions like that, that's often like could be even a PhD, because a PhD in nursing, of course, there's a couple of different avenues, and there's some that are research oriented, but there's like DRPH or doctors of public health, you know, so there's like those advanced degrees can often provide you an opportunity to like ask those questions. And in some ways you sort of make your own thing by asking the questions and getting to know people and networking like that. So it may be counterintuitive that a research position may end up giving you a job in a very practical way, but it can in the sense that you start to learn and network and find out about those. So it's not kind of a backwards way to answer your question, because I don't really know of any specific programs, but I do think that like seeking out those PhDs in nursing, like looking at those programs and seeing if there are sort of comparative programs that might be helpful.
Rachel, I just want to say I updated your student information, but I'm going to put you in touch with Evelyn Begini, which I think she graduated after you, but she was an RN and she's gone into global health in a big way. And are you in LinkedIn, Rachel?
Yes, I am.
Okay, I'm going to connect you guys via LinkedIn.
Wonderful. Thanks so much, Elaine. I appreciate it.
Nice
and
seeing you.
Thank you, Hillary. I agree. There's always so many questions and things to uncover and figure out.
The one thing I would add that I didn't say is also that I don't know, like I know in terms of the midwifery space, like the International Council of Midwives, like ICM, and sort of if you look at those professional societies, that's often an avenue for looking at places where, you know, because a lot of them are global in scope, so you can see intersections and make connections with folks. So that would be another place to look.
I will, and ironically, I'm applying to labor and delivery right now at McGee, so it's just like everything is kind of blending. So very cool. Thank you.
Judith, you had your hand up.
Yeah. So my question is just like, I know oftentimes with just like people that work with global health or public health, we have like you guys are working in like under-resourced like communities. My question is just because I am part of the pharmacy school and I'm part of like the global health like area of concentration. And right now we have like a global health day under the year of emotional well-being. So we have a global health day coming up in like February where we talk about compassion fatigue. So my question is just not really how to prevent it, because I genuinely don't think it's like preventable just because of circumstances, but just like what are sustainable like methods you guys use to like actively work against compassion fatigue and like just try to like help your emotional well-being as a whole?
I mean, one thing I think about is just how, like, by working in this field, we are defaulting to, or we do our best to default to work with our values instead of against them. So we don't, so that helps, because sometimes if you can only do the bare minimum, you know that, okay, you're doing something that aligns with your values, at least for the most part, as much as it can in this current system. I also feel like the unfortunate truth in a lot of, I can only speak for nonprofit spaces, is that the higher you go up in your role, the better it might become, because usually you're not, well, first of all, you're getting paid more. You're probably not, or may not be interacting directly with like patients or clients, which is really difficult. And I wish it wasn't like that. So what I try to do is, like, for the people that I supervise, try to like help them as much as possible and like make sure that they're getting compensated fairly. But for me personally, it was like, I knew I didn't want to work directly with patients forever. And so it was a matter of like needing to get out of that space for myself, knowing that a lot of people can't do that, and or they want to continue working with patients and grow up that ladder, like in a more clinical way. And for them, I don't know how they do it, because I don't know how nurses do it. And because for me personally, like, I need to be a little bit separated from it. Like, I'm okay looking at an Excel sheet. But I think for everyone it's different. So that's, I guess, kind of a specific answer for like the type of space I've worked in, which is like serves patients and clients directly, but not everyone in the organization does. So.
Thank you.
Oh, Hillary, you're muted.
Oops. No, I was just going to say, to Maddie's point, I feel like right now, at least I feel very far away from what's on the ground, which has its pros and cons at moments, but so I can't really speak to that, but it does resonate with me what she said, that if you, because I feel so like fortunate and blessed to have had the career that I had, and that I've been able to make a career, you know, where my, you know, work aligned with what my values was, whether it be working in reproductive health, which is still super important to me, although I don't do so much of it now, but, and so I think that is some solace. I think, especially, you know, even when you're at this sort of remove of doing research, that where you're looking at data sets and spreadsheets, that what you're doing is in some ways making a difference. But it's very different than obviously being front and center and dealing with patients and community members, you know, that have complex needs, and sort of in the current policy landscape, especially. So I appreciate that's a very different experience than the one I have. So.
Also, I should add that whether you want to work directly with patients or clients or not, try to find a supervisor that uses this language. Like if you ask that question in an interview, it's a green flag if the supervisor can like talk openly about it and not get defensive. If they ask you that question, that's also a green flag. I think it's becoming more common now to be like, what do you do for self-care? And employers know that they have to ask that, but like I think you can feel out the vibe and just be like, okay, does this person actually believe in that?
Yeah, thanks. I like the and then about like interviews. Thank you, guys.
Caroline?
Hi, I hope you can hear me okay. I'm sitting in the public health commons. Well, I really like what you guys have had to say. It's so inspiring and it gives a good perspective, especially for me as a current MPH student. I'm a first year in getting my master's in epidemiology. So I was just curious, Maddie, how did you find your various different roles? That's something I'm struggling with, looking for internships that and like just looking forward into the future for potential jobs. I've been on LinkedIn and I've been on Indeed and stuff like that. And I'm just wondering what you have, what other thoughts you have on that.
Yeah, so my first job at UNC Health and then my current job, not super exciting. It was just more of like what you're doing, but searching lots of different keywords because like I recognize that I don't even think that my current job has the term public health in it. So if I had just searched public health, it wouldn't have popped up. But if you know what city you're going to be in, that helps because there's a limited number of like either if you want to do a government entity, nonprofit, etc. If you're like, oh, I want to be at UPMC, then like that's half the jobs there already. So you like use their search engine. The one interesting one was when I was moving from North Carolina to Philly because I had no connections and it was the beginning of COVID. And so I reached out to someone I did AmeriCorps with I think the director of AmeriCorps, but I had done AmeriCorps in Pittsburgh. So still I had like no Philly networks. They connected me to the Philly chapter of that same AmeriCorps program. And that chapter is located within the Health Federation of Philadelphia. So then I just like set up a call with someone at the Health Fed. And I was like, tell me about the public health landscape in Philly, because I'm looking for a job. And I think it's about finding someone who is like really willing to have that honest conversation with you. Someone who you have a good rapport with, because then they'll be invested in wanting to find opportunities for you. And so I didn't meet with her and immediately said like, give me a job, but she knew that I was looking to move there. And she ended up connecting me with someone. And that was that like FQHC job, that first job I had in Philly. So once you do have a job in the city, I would say it gets easier because you become aware, like by having that job, I learned about what MCC is because people would refer patients there and vice versa. So I think, are you looking in like nonprofit specifically, or you're not sure?
That's the thing. I'm kind of looking everywhere. So
Yeah.
I kind of had a follow-up question for you too, if I can throw that
Yeah.
at you as well. What is the setting that you work in? Which is kind of random, but like, are you remote? Are you in an office building? I was just curious.
Yeah, I'm mostly
Same for you,
remote.
Hillary.
Yeah, so I'm mostly remote. I can go in. I go in usually like once a week. So we have a site in North Philly. I like going. I would go in more if it was closer. It's like it's a schlep for me, but it's really good because you can like form relationships a lot quicker that way. Like I found that starting a job virtually is like I feel really stunted in like the relationship building aspect, but yeah, otherwise it's been great. And of course, like remote is also a privilege for many reasons. So yeah.
Thank you. That helps a ton.
Yeah, of course.
And in terms of where I work, I live in Charlottesville, Virginia. Our office is in Washington. And I was hired during the pandemic and worked remotely up until we started going back to the office last year in the fall, I guess. And so I go to Washington one day a week. So that's sort of where we are now. I will say, prior to that, when I worked at Genuity Health Projects in New York, I also worked remotely, which was kind of rare, but it was sort of, we did so much work in global health actually that they realized we didn't need to be in the office because most of us were traveling or, working with people in different places. for so much of our time that it wasn't that important to be there. So I do feel like in global health, there's a lot of flexibility on that front, just because people recognize that it's often that folks aren't in the same place. And so, yeah.
Thank you. And sorry, this is my last thing. Elaine, I know we've chatted before. I was just curious, I kind of a similar question as Rachel. Is there any way that I could also get on that LinkedIn connection? That would be super helpful.
Of course. Yeah.
Thank you so much. I appreciate it.
Yep. I have some more ideas on that one too. I want to just tell everyone, we have a global health case competition that we hold each year for undergraduate and graduate students. And this past year, we looked at Rohingya refugee, healthcare system of Rohingya refugees. And we had a nurse who came, who has done a lot of work globally. And we might invite her back in to have a conversation with us. Because she really had great ideas on how to get out there and work internationally. Let's see, what Cindy Salter's on right, taking up. Okay, Nettie, are you still here? I don't think she's here. She had a question, but I think she popped off. Other questions? We have like 4, 5 more minutes before we wrap up.
There was one in the chat, but I don't know the answer to it. The one about clinical exercise physiology.
Yeah, I believe she may have left.
I'm still here.
Oh, I'm sorry, sweet. Okay, I see you right here. You're right. Your picture is right there in front of me.
Right. I think I posted it in the chat. So I'm a graduate student in clinical exercise physiology, and I'm doing a non-thesis master's, and I'm interested in a program in public health because back home, I'm actually from Lesotho, back in Africa, and I run a wellness consultancy, and I'm quite interested in preventative measures. So the other thing that I'm doing is to try and establish Exercises Medicine National Center in Lesotho. So I'm quite interested in public health. So I want to know if a non-thesis master's program would be a barrier in getting into a PhD program, or what would I have to do to get into a PhD program in public health, or rather to strengthen my application, because I know that a PhD program requires like a background in research, and having done a thesis would be an advantage. What would you say in terms of that?
I mean, I guess I can speak to my experience because I got my MPH a fair amount of time ago. My PhD is actually in history, but I can say that when I was in public health school is that at least at Hopkins, they admitted folks with even if into the master's, as long as you expressed an interest in a research area, for example, or, you know, I guess it's not a hindrance for you not to have done a thesis, I don't think, to applying to a PhD program. If anything, it sounds like you, just from what you said, that you're very focused and you have a clear idea of why a degree in public health is important to you. And that is essential for a successful application, I think. And so I guess I wouldn't discourage you because because it's a non-thesis master's to apply, because I think, again, because public health is so broad, they're looking for people that are coming from all different perspectives with regard to, especially PhD programs. So apply, I would say.
Thank you, Hillary. I really appreciate it. Yeah. I'm excited, actually. Thank you so much.
I had a quick question for Hillary, just out of curiosity. What when you were in the Peace Corps org for like West Africa, just I guess like how did you fully get involved. I know in the beginning I was also doing like coming back from class, so I wasn't fully listening, so I don't know if you had mentioned it, but like how did you get involved in it, and what country were you able to visit? Because I know you mentioned West Africa. I was just wondering what exact country.
Sure. I actually applied for the Peace Corps while I was an undergraduate. So in the fall of my senior year, and when I applied, again, it's been decades since I did this, so I don't know if it's still the same, but I wasn't really specific about where I wanted to go. I did know that I wanted to do health, and so I was a health education volunteer, and I worked in the Ivory Coast in Cote d'Ivoire, and I worked in a small village and did we had there was a maternity and a like health center essentially a nurse. I will say it's not, health center is a very big term for what it was, but I did health education in conjunction, in collaboration with the midwife and the nurse. And then also because of where I was located, it was very rural, and so a lot of the population was outside the health center, so I spent a lot of time, they gave us bikes, so I rode around on my bike weighing babies. Actually, that was a lot of my job, was weighing babies, and doing health education. Actually, it wasn't so much me doing the education, obviously it was in collaboration with community members and sort of figuring out. At the time we did a lot of AIDS education. There was a big program for that, and so I worked with school groups and community groups to sort of do that kind of work. So it was a great experience. It's in terms of like thinking like through public health, especially in the global context. I think it's a great first opportunity with the Peace Corps, and a lot of my friends who were volunteers with me went on to careers in public health in various capacities. So I do think it's a wonderful opportunity for that, and I encourage you to just check it out and see if it seems like a good fit or not. And now I know the volunteers are doing like even more exciting work, actually, in a lot of ways, like environmental, that we had water and sanitation volunteers, but there's a lot of other stuff that's going on too. So it's a good way to find a place, and especially I would say, and to understand like bilateral funding and the kind of programs that U.S. government is funding, as well as other people that are working in the field and community organizations. So that's it. And if you have other questions, but yeah, that's kind of my experience.
Thank you.
I'm going to pass it over to Shaksova, because I know we probably have 1 hour of your time. And tell us what else is coming up as part of the Career Toolkit Series, and then you can thank our speakers.
Thank you a lot. It was amazing session, and I'm really glad that we have speakers such as Hillary and Mary today. Thank you a lot, and thank you for those who joined and your questions. So as part of the Career Toolkit Series, today we had the first session, and next one is coming on Monday, on 13th of January, which will be a kind of workshop, how to apply for job and how to make your application materials, which will be in person, and it will be at 5 p.m. So I really want to thank you everyone for joining us one more time. And Ellison, if you do have anything to say. No, okay.
I know, just thanks for organizing this, and thanks Elaine for moderating, and to our guests for attending.
Yeah, thank you.
Thanks for having us.
Nice.